A hormone analog drug is administered to a patient via an injection. The patient dislikes needles and asks if he can take the drug via an oral route instead, but the doctor says the drug would likely be completely ineffective if taken in this manner. Which of the following is this drug's most likely structure? Choice A, linear hydrocarbon. Choice B, aromatic hydrocarbon. Choice C, fatty acid. Choice D, peptide. Or choice E, nucleic acid. I'll wait 5 seconds and answer the question. Now, I know this might seem like a very dumb and basic biochemistry question to some of you, but they actually have questions like this on the NBMEs and the USMLE, so might as well get these out of the way. They actually pretty often ask questions about you knowing the difference between peptide hormones and steroid hormones, which is to say the lipid soluble ones. And it's a pretty similar concept here as well. Added on top of the fact that you need to know that in order to take a drug orally, you need to pass it through the GI tract, obviously, which includes various enzymes and a very low pH, right? So the type of bond that is most susceptible to being broken down the easiest is a peptide bond. So choice D, peptide, is the correct answer. Not a whole lot else to say here, right? So looking at the wrong answer choices here, choices A, B, and C, which is basically hydrocarbons and fatty acids, these are all more chemically stable in the GI tract, and they're also lipid soluble, which means they are more readily absorbed. So they're less likely to be destroyed before reaching the systemic circulation. And choice E, nucleic acid, is just straight up wrong because I mentioned a hormone analog, and nucleic acids do not make up hormones. So even though they do get broken down in the GI tract, it doesn't even make sense as an answer. So I guess it's kind of a trick answer, and I was being a jerk putting it here. So yeah, sometimes they just like testing you on some very basic biochemistry facts, and you need to be ready for that. I hope you found this video helpful. I'll see you in the next one.